Hi everyone, so today we're going to review the notes on the abdominopelvic subdivisions. So, why do anatomists need to identify regions or quadrants in the abdominopelvic cavity? So, in this lesson we're going to go over why these subdivisions exist in the first place, and then we're going to go over two types of subdivisions, the quadrant system and the region system. And you should learn the terms that are specifically associated with each of those systems. Now, why do we actually, as anatomists, subdivide the abdominopelvic cavity? So, these subdivisions are imaginary. So, what we're basically doing as anatomists is we're kind of mentally drawing imaginary lines over the abdominal cavity. It could be lines that divide it into 4 parts, or it could be lines that divide it into 9 parts. But either way, we want to do these subdivisions because the abdominopelvic cavity, basically, if you recall from the last lesson, it's one of the largest cavities. And again, a cavity is an opening in your body for organs. And it's the cavity that contains the most diverse amounts of different organs. And now it's going to be a lot easier for me to communicate to another medical professional where the patient is injured, where we're doing surgery, or possibly what we're going to need to treat. If I know a patient is hurting in this region, and this region, then I know as an anatomist those are the regions where the liver is found, and any other organ that might be in this corner, that if it's not found in this corner, then it helps me as an anatomist go, all right, so this is probably a potential liver issue and not just a kidney issue, for instance. So that's sort of the reason why we use that, and then it'll just help us refine what we might want to look into when we go into blood diagnosis, if we go into MRI, etc. All right? And like I mentioned with the liver, how it spans many regions, many organs actually occupy more than one region or more than one quadrant in any given system. All right, so these are the two types of breakdowns. We have the quadrant system, abdominopelvic quadrants, and then we have the region system, abdominopelvic regions. So there's 4 quadrants and 9 regions. Okay? Now, for the quadrant system, they're actually have the best name because they're very intuitive. You have the right upper quadrant, we have the left upper quadrant, we have the right lower quadrant, and we have the left lower quadrant. So take a moment and copy this chart right here down. And then I want you to write down the organs that are associated with those regions. Okay? So, in terms of your class, most likely, unless it's specified by your teacher, what we're going to ask you to know is just know where the regions are when given an image of a torso. Okay? So if you're given an image of a torso and then you see a grid drawn onto it, and I ask you to say, all right, what is the name of the B subdivision? Then you should go, oh, it's 4 different parts. It's on the upper left side. It's the left upper quadrant. Okay? And if I give you an organ, for instance, what quadrant is the liver found in? Generally speaking, at least early on in anatomy, since we haven't really learned the digestive organs yet, because in the abdominopelvic region, there's a lot of digestive organs. Since you're not familiar with all of them quite yet, what we're more likely to do is to give you a picture of the organs and then blur out the names of the quadrants. And then I'll ask you, where's the large intestine found? By the way, whenever you see the word colon, that's just a fancy term for large intestine. Okay? But then you should go, okay, I see the large intestine here, 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 and here. Okay, it's found in every single quadrant. That's about what we're looking for. But as a guiding thumb, I'm just going to give you the list of organs so you know what you're looking at. If I want you to memorize the organs associated with each quadrant off the top of your head, then you'll get additional practice and additional worksheets, and it'll be on your study guide. Okay, so if you haven't finished filling out your chart yet, pause this video, and then once you're ready, hit play and move on. Okay, by the way, if you look at the prior image, you may not realize the pancreas spans both sides because the prior image only shows the superficial organs, the organs at the very top. There's actually other organs layered underneath of all these digestive system organs. So the pancreas you kind of only see a glimpse of on the right upper quadrant, but in fact it spans, because it's hidden underneath the stomach, it spans both of the right and left upper quadrants. Okay, the next subdivision is the abdominopelvic regions. So this one is more precise than quadrant, because the quadrant is 4 versus the abdominopelvic regions is 9 different sections. So I'm more likely to use the region system if, as a doctor, I'm able to like push onto your abdomen area and diagnose it with specific pinpoint accuracy. If it's sort of a generalized pain that's more spread out across your abdomen, then I'm more likely to use the quadrant system to write something down in your chart. Okay? So this is actually a big reason why when you go to the doctor, they press their hand in a specific way along your belly, because what they're actually doing is they're pushing down at each of the regions. And if you feel a sharp pain, they'll make a note of it in your chart, and then they're more likely to order certain tests to see if there's something that you might have an issue with. Okay, so our 9 regions are the right hypochondriac region, the epigastric region, the left hypochondriac region, the right lumbar region, the umbilical region, the left lumbar region, the right iliac region, the hypogastric region, and the left iliac region. Now, really quick, if I haven't mentioned it already, just a heads up, both of these grids are centered on the belly button. So the center of the 4 quadrants is right on your belly button, and the very center square of the region system is right over your belly button. So just a heads up. And these regions and quadrants actually span the entire abdominal cavity. So it actually goes all the way from your right underneath your breasts to basically where your groin is. That's how big your abdominal pelvic cavity is, and it's all full up with organs. Okay, so going back to this chart, please take a moment and write the abdominal pelvic regions and the organs found within it, and that's going to be on the next slide. Now, I also highly suggest that because the naming is a lot trickier, I would, on your paper or notes, if you have them, just draw a grid and then write in the names of each of these regions in each section of the grid. So something like that. Okay, so these are the organs found within each of these regions. So again, pause the screen to help you write down all the organs. And then after that, I'll go over some tips and tricks to help you remember and differentiate these different types of regions. Now, one thing I may have forgotten to mention is these regions refer specifically to on the patient. So even though it's on the left of this page, it means the patient's left. Okay, so when we say left hypochondriac region, we mean the left side of the patient you're looking at. So this is the picture of the patient facing you. And when we say left, they don't mean your left, they mean the patient's left. So your left hypochondriac region is on your left side of your body, not the left of whoever's looking at you. And you can see how this can get confusing because someone says, oh wait, you're going to cut on the right of the patient, and then you start making a cut on the right of the thing that you think is the right, and it's actually your right, not the patient's right. So this is a big reason why in medicine and surgery, if they're doing a really critical surgery, they actually write someone comes in and triple checks that you're using the correct terminology, and they'll look at your chart and then they'll write literally on the person's body in Sharpie, yes, on the side that you're doing surgery, and no on the side that you're not supposed to do surgery, so you don't make a mistake. So again, if you haven't finished filling out this chart, just pause it and then press play when you're ready to go over the tips and tricks. Okay, so tricks for remembering the name. So the right and left side basically mirror each other. So there is a term for upper, right or left, middle, right or left, lower, right or left. So, and then the middle has its own unique names. So let's start with the middle regions. So remember, the center of this entire grid is right on your belly button. And if you remember, the belly button is attached to your umbilical cord. And that's why the middle region is called the umbilical region. Now, the term epi means above and hypo means below. And gastric is just a term for your tummy or your belly or your stomach. A trick for remembering this for me is if you know the difference between an EpiPen and a hypodermic needle, right? Hypodermic needles are those long needles that you use to get a vaccine, and they are very deep, and they go deep into your skin. And an EpiPen is a little tiny pen you use if you get an allergy reaction, and the needles are very tiny and short, so they just stay in the top layers of the skin. So that's how I remember. Epi means the top, and hypo means the lower levels. So the top of your stomach is the epigastric. The bottom below your stomach is the hypogastric. So that's how I remember that. All right, now touch your belly button and feel parallel. What area of your back is parallel to your belly button? That's your lower back. And some people know that the lumbar area of their back is the lower back. Some people know that because they get massages or they hear about like lumbar pain. So that's why I mentioned this. So the lumbar region is actually the middle region of this grid because your lumbar area is parallel with your belly. But again, if you feel your back side, what's parallel to your belly button? Your lower back. So that's why it's the left lumbar region and the right lumbar region. All right, I don't have a lot of ways to remember the differences between iliac and hypochondriac because they refer to bones that you're not familiar with yet. So iliac is a section of your pelvic bone, so that's why it's called the left iliac region and the right iliac region. And chondriac refers to the cartilage of your ribs. Chondro is the root word for cartilage. So chondrocyte means cartilage cell. And again, we haven't gone that deep into anatomy yet, so that's not super helpful. So what I do is I know what a hypochondriac is. So a person who's a hypochondriac, if you hear the conventional term, oh, he's such a hypochondriac, it's someone who just is like on the internet and maybe, Google's my right arm is itchy, and then they get 5 million links where they say you might have cancer, and then they're like, oh my gosh, I have cancer. It's someone who's constantly paranoid about getting sick. Now that's a little ironic now that we're in the pandemic age where we're all a little bit paranoid about being sick, but that's what a hypochondriac is. So they're always blowing stuff up, getting a little hyper and a little like little too keyed up, anxious about feeling ill. And that's how I remember the hypochondriac region is like the upper corners because they're just kind of it's kind of like the upper anxiety levels. And that's how I remember hypochondriac region are the upper corners of this grid. Okay, now this is a picture of the regions and has the organs more clearly labeled. So for those of you who are unfamiliar with the organs, this is just another image so you get used to them. You should be definitely familiar with the location of these organs, though, by the time you reach the digestive unit, for certain. By the way, for those of you who don't realize, I know I mentioned in early notes or earlier slides, but colon refers to sections of the large intestine. So colonoscopy is when they're videoing and diagnosing your large intestine. And this is just another way of imaging the regions and then the organs associated with the regions. Oh, and if you see the word duodenum, that's the duodenum is a part of the small intestine. Okay. So, recap. As anatomists, we want to subdivide the very large abdominal cavity for diagnostic purposes, and the two subdivisions are the quadrant system and the region system, and you should be familiar with where exactly those are located within a grid. And then, if given some additional practice or charts, you should be able to roughly map and identify where different organs are found within those grids. All right, move on to any other work you have. Bye.